Let's get reaction now from a leading supporter of the public option, former Vermont governor and former Democratic National Chairman Howard Dean. Governor Dean, good morning.
Good morning. How are you?
I'm well, thank you. I'd like to read back a quote, something that you told me back in August when we talked about this. You said, "You can't have reform without the public option. But as you know, this plan devised by these 10 senators does not include it. So do you oppose it?"
Actually, not at all. Medicare is a public program, and it's a single payer run by the government. So, I judge all these plans by whether they move things forward or move things backward. This moves things forwards. We should have used Medicare.
So are you saying this is just the public option by another name?
No, what I'm saying is it is a public program that people over 55 are allowed to buy into, and it makes a lot of sense because you don't have to reinvent another bureaucracy to do it. This is what should have been done in the first place, this kind of thing. So I think this is still real reform. Whatever we call it is irrelevant. Is it going to work? Yes, it is. Now, of course, the House coverage is much broader, and that's very good. And there had to be some things given up here to do this. But I think this puts us on the right track.
Let me just interrupt you and say that a lot of people would disagree with you that it would work, because the criticism is that Medicare as it stands doesn't work because the payments don't cover the plan. Are we just not creating a bigger problem if we have to insure more people under Medicare?
No, not at all. Medicare is a very, very effective program. It's a government-run single-payer program. Everybody over 65 is in it, and it works very well. These expenses are going to be adjusted later on. There's not much cost control in this bill on either side, and that's going to happen later on. It's already starting to happen in the states. Massachusetts, for example, has proposed ending fee-for-service medicine. This is a good step forward. This isn't perfect, and the coverage is not broad enough in my view, but I do think this is a positive step forward. I think using Medicare makes much more sense than reinventing a different bureaucracy.
What do you do with the fact that the House has a completely different bill on the table, which does include the public option? Can this go forward?
Yes, there's no reason you can't have both, and there'll be some kind of reasonable compromise. Maybe, and I hope whatever they do, the compromise involves expansion of care. That's the most important thing that we're looking at, is expansion of care. And we've got it in the Senate bill, and it's using the Medicare as the substrate, and that's an important advance.
All right, Howard Dean, thank you so much for your time, as always.
Thank you.